Hello, I'm Dr. Opera. Today we're going to be speaking about a serious problem in this world, and that's anal cancer. Today I have two very experienced doctors here to talk about it. First doctor is Dr. Anthony Hidapdo. Welcome, Anthony.
Well, hello, Opera.
I'm doing good. How are you?
Good. I'm pretty doing shabby myself.
All right. Next, we have a very experienced doctor here to talk about it together with the two of us. His name is Dr. Tipo Dick. Welcome, Tipo Dick.
How you doing, Opera?
I'm doing good. How are you?
How are you, Henry?
Pretty good.
Nice
Myself.
having you on
to
the
see
show.
Yeah.
Thank you for having me.
Question for you, Anthony. What was the first reported case of anal cancer?
Well, you see, anal cancer has been here for so long in history that we don't have any documentation of the first actual anal cancer person.
All right. So, Dr. Tipo Dick, what are some of the causes of anal cancer?
Actually, I have my assistant here. Come here, Justin. Some of the causes are actually smoking cigarettes or doing drugs, and obviously old age. You can develop some of these symptoms, and another is actually anal intercourse.
So, Dr. Suyang, this question is for you. So, what's the location and the symptoms of this anal cancer?
Well, first of all, the location of anal cancer usually occurs at the end of the rectum, also known as the anus. Now let's get into symptoms. Some of the symptoms of anal cancer involves itching in the anus, redness in the anus, swelling in the anus, anal discharge. And for you guys who don't know what anal discharge is, it is an uncontrollable excretion of human waste coming out of the anus.
All right, guys, we are going to a short commercial break. Thank you. Do you have itchiness?
Or pain.
Or discharge.
All in the anus. Then you have anal cancer. Call us at 1-800-ANAL-CANCER.
All right, we are back. Now, this question is for you, Mr. Tipo Dick. Please just explain to us real quick, what's the prevention of anal cancer?
Of course. So, first of all, don't do drugs, kids. That is a main cause of anal cancer, like I mentioned earlier. And don't smoke cigarettes. Another thing is don't practice sodomy. And there are a number of vaccines you can take to prevent anal cancer. And just talk to your doctor for more information about all of those.
All right. So, Dr. Tipo Dick, could you explain what you go through to, diagnose anal cancer?
Yes, if you had any of these symptoms that Dr. Mai, that he discussed, you would, first of all, one measure you could take is examining the anal canal, or taking an ultrasound of the anus. And finally, if none of those were showing anything, you could take a sample of the anal tissue.
All right, Dr. Nguyen, could you please explain some of the treatments that you could tell the audience?
Well, after that diagnosis, and then we figure out you do have anal cancer, we suggest you go straight to surgery to remove the tumor out of the anal canal. And if either two of those don't work, we suggest for a treatment of anal cancer that you go through either chemotherapy or radiation. And now, there are also some side effects to doing some of these treatments, and they consist of hair loss, weakening of the immune system, weakening of bone marrow, and it makes you nausea.
All right, Mr. Tang, or whatever your name is, could you talk about the cure rate of anal cancer?
Okay, so with cure rates of anal cancer, through my calculations, I did calculate that there are 4 stages of anal cancer that could be treated. With stage 1, I calculated there's about 60 to 70% of success rate. And then with stage 2, it's about 50 to 30%. And then once you hit stage 3, it's pretty as low as 25% to 10. And then with the stage 4 of anal cancer, you you should just give up because it's as low as 7%, my friends.
Not if you have faith in God.
This is why you are Oprah, kind sir. Your positive attitude and wishes. Yeah,
Thank you, sir.
Yeah, of
Thank you.
course.
All right.
God is with you, my friend.
So this question is for both of you. Could you talk about the demographics?
Of course, Dr. Opera. First of all, for my studies, I found out that anal cancer, is more frequent in women than in men, and it's around the age of 55 to 64 that we see most of these cases come out.
Also, through my discoveries and research, I have found out that in higher wealthy incoming countries such as Australia, United Kingdom, Denmark, the Netherlands, and also the United States of America have a higher rate of receiving anal cancer patients.
Wow. Serious stuff.
You learn something
everyone.
new every day.
Alright.
All right, so we've learned a lot of stuff to help us with the knowledge of anal cancer, and I just want to take time to thank Mr. Ting Ting over here. Thank you
Oh,
very
it's my
much.
pleasure.
All right, and then we have here Mr. Tipodic.
Tepotic.
All
Oh,
right,
yeah.
thank you very much for coming to our show, and I appreciate you guys. Thank you.
I appreciate you. You have a good night.
All right, thank you. All right, next time on the Opera Show, we will be talking about the 72 different genders that we have in this world. Thank you for watching, and see you next time.